Good evening. Good evening, ladies and gentlemen. It's working, I think? Yes, nice. Well, welcome to the national headquarters of the Theosophical Society in America. My name is John Tian Jin. I'm the Director of Public Programs, and I'm very, very happy to see so many new faces. Thank you, Peter. You brought a new audience for us. That's wonderful for us, and I'm sure it'll be wonderful for all of the people who have come. At this time, though, I would like you to turn off your cell phones and other noise-making electronic devices. And this evening's presentation is being streamed live, so there are many people watching through the internet, and we welcome those people as well. The Theosophical Society promotes study, meditation, and service. We encourage open-minded inquiry into the world religions, philosophy, science, and the arts. And we have a deep respect for the unity of all life. Our goal is to help people explore the spiritual path so as to arrive at a deeper understanding regarding the wisdom of the ages. Furthermore, we feel that this wisdom is not limited to any one tradition, and thus we offer programs from many, many traditions. If you have not already done so, I do encourage you to pick up one of our program catalogs. They're available just outside on the small table, and there you'll find all the programs that we are offering during the coming months. These programs are also listed on our website, and there you will be able to register for any of those that are of interest to you. The Theosophical Society is a membership organization, and we are always happy to welcome both new members and renewing members. However, what we offer here is open to the public at large, and everyone is always welcome to attend the programs, to make use of our library, bookshop, and of course the 40 acres of parkland that constitutes the grounds of this campus. This evening I'm very pleased to be able to introduce Peter Harvey, who is probably known to many of you because, as I said, he seems to have brought an audience that is not part of our regular attendees, but so we're very grateful and very happy. Peter is the owner of Eastern Healing, an acupuncture and traditional Chinese medicine clinic specializing in the treatment of pain, fertility, and women's health. Peter has extensive experience in treating pain of all types. He began apprenticing in the Midwest and later spent time in China at a teaching hospital. He went on to graduate from Midwest College of Oriental Medicine and is a fellow with the American Board of Oriental Reproductive Medicine. Peter himself has suffered from chronic pain since he was 16, but fortunately he's currently pain-free. And so he's most qualified to be able to speak on the topic of this evening's talk, which is treating pain through the mind-body-heart connection. Please join me in welcoming Peter Harvey.
Okay, how's everybody doing today? Can everybody hear me and good? Okay, great. First off, I really want to thank the Theosophical Society for having me here. I really appreciate this, for this opportunity, and thanks for coming out. My hope for everybody here is that you pick something up from what I'm about to talk about today. You know, I love dialogue. I know at the end of the talk, we'll have time for questions, and I know they only gave me 6 hours to talk, so, you know, I'll try and fit it all in for you. So, but anyways, without further ado, let's get going. First, here's a legal disclaimer. You can't sue me. That's simple, but basically, I'm not an MD. I'm not a psychiatrist, a psychologist. As you'll soon find out, a lot of what we're going to be talking about is about emotions, about how emotions affect us, you know, as people, what drives us. And I do work with a lot of doctors who specialize in what I do on the Western side of medicine that we team up and I refer to and work with. So anyways, let's talk first a little bit about me and about my story and why and how I got here on stage talking to you all. As John had mentioned, yes, I am a licensed acupuncturist. The MSOM, just for education, means I've been trained in herbs. It's a Master of Science in Oriental Medicine. I follow with the American Board of Oriental Medicine, and I hold an MBA from Dominican University. Trained in the U.S. and China. Basically, I started out when I lived in Utah for my corporate job. I always had exercise-induced asthma, and as a result, I needed other treatment because Western medicine wasn't helping. I used to do triathlons, and I was choking in the water, which is not a good thing to do. So, woman treated me for almost 6 months, cured me of it, and I said, I've always wanted to get into medicine. And I ended up approaching her and said, let's make a little deal here. I'll teach you business, how to grow your practice if you let me apprentice. She loved that idea, so I put in about 3 years of training, somewhere between 2,500 and 3,000 hours of side-by-side training with this woman. She specialized in mostly sports injuries, so we got to see a lot of the U.S. Olympic team, some Utah Jazz players at the time, and whatnot, and then some women's health. Moved back to Chicago for my job, and she calls me and she goes, hey, I'm going to China. Why don't you meet me out there? So I met her in Tian Jin, China, trained at the first teaching hospital. Came back, decided to go to school for this, and well, the rest is history. Chronic pain since a teenager. My first job, well, actually my second job. My first job, I washed dishes in a banquet hall. That's an experience, but basically I worked at a lumber company, and you can see I'm not a big guy, right? And carrying heavy loads of lumber and whatnot. And one day I was helping a customer load a garage door onto his roof. He dropped the door, and I saw this wave my whole back. I felt from all the way down from the pelvic bone up to the shoulders, just a total strain. So I can remember for literally months laying on the floor, sleeping on the floor to try and help the pain. That's what they always say. Well, we'll sleep on the floor. It'll go away. It'll go away. And it did. It would come and go. I would lift a little bit too much or twist in a weird way. The back would give out or the neck would give out and everything. And of course, in your youth, you do a lot of things because you think, oh, I'm going to live forever, right? So let's do full contact fighting. That sounds like fun. Broken ribs and messed up jaws and fingers and being thrown on the ground, and that rattles the body up quite a bit. And that just kind of led on to, my adult life. Living in Utah, I love to ski. Well, a few ski accidents there, car accidents, been shuffled around and whatnot. So, one of the things we're taught, especially in Western medicine, you hear a lot of is that, injuries and pain are cumulative. They start out, you fall down, okay, well, that could be an injury, right? Get into a car accident, oh, there's another source of the pain, Let's take a look at you. Let's see, what's going on. And they come to find out, several years ago, it was getting bad. I was getting severe neck spasms, back spasms. I suffered from migraines and everything. And keep in mind, I was a GM for Morton Salt. I ran companies for them and whatnot. And while running companies, I was also going to school for this. And this is all kind of significant in what I'm trying to explain. And it just kept escalating. So finally, when I was at Morton, it was our 5th downsizing. I left Morton, went on to do this full time. Bad back spasms, severe back spasms, neck spasms, migraines. I go on and on. Got an MRI. I was scared to death to get an MRI because I'm thinking, I already think I know what's going on here. And just of the lumbar area, they find 3 herniated discs in my back. One full-blown right into the central canal, one blown to the left, one blown to the right, facet joint degeneration, disc degeneration, and severe spinal stenosis. So the doc looked at me and goes, you got the back of an 85-year-old. He goes, I don't see this in people your age. He was really concerned. He wanted me to do further testing. Let's look at possible surgery, microdiscectomy, fusion, blah, blah, blah. And I said, let me hold off. I'm going to Utah to do some backpacking. And he's like, no more than 10 pounds in that backpack. That's it. And I'm going, well, that's not going to happen. I go, but it's really odd. I go there, and I go, I've hiked, I've jumped off of rocks, everything. I go, I have no back pain. It doesn't exist, you know? Fast forward into now, I'm doing a lot better, and I'm going to get into how I help myself. Do I still have pain? Absolutely, I still have pain from time to time, you know? This quote I love, and I interjected a couple quotes in here. It's from the Neijing Suwen. The Neijing Suwen is basically the original book on Chinese medicine. It's about 2,200 to 2,500 years old. It talks about diagnosis, treatments, and whatnot. And basically, the channel, blood, and energy of a man will be affected and changed by terror, fright, anger, and fatigue, etc. Under these situations, if one has a strong body, his energy can be dredged and his sickness can be recovered. If his body is weak, the evil energy will hurt the body in the wake of it. Basically, what they're saying is that if you have a strong constitution, if you take care of yourself and you feel good, and all of a sudden you fall ill and whatnot, well, they can dredge up that energy. They can get that energy back, make you feel good, okay, and you'll be okay. But if you're weak, and you have a weak constitution, and you get sick, it's going to keep going further. The one thing I want everybody to understand is we're all human beings. We're all dynamic individuals. Okay, we're all composed of cells. We're all composed of energy, of matter. We can change. Okay, we may not be like we were when we were 18, you know, but we can still change. We can still have some type of vibrancy in our body. So let's talk a little bit about what is basic pain diagnosis in Chinese medicine. You come in to see someone like me, and you're going to hear all these terms. And keep in mind, this is a very simplistic view. Okay, this list can go on, and there's subsets that go on, you know, to all this. But blood stagnation. So a characteristic of blood stagnation is sharp stabbing pain. Grabbing pain or whatnot. Women who have severe menstrual cramps that just really hurt. Migraine headaches where they're just pounding headaches and everything. That's what we say, okay, there's blood stagnation. Blood isn't moving. A good visualization is if you fall down, you get a bruise. The color of the bruise is what? Purple, blue. That's blood stagnation. Nothing's moving in there. Qi stagnation. Often these two go hand in hand. Qi stagnation would be like a dull ache. You have a dull headache, you know, oh, my shoulder just kind of achy a little bit. It's not really killing. I could move on with it. It's okay. You know, that's what Qi stagnation is. And you're going to hear a lot about this term through this talk. Wind pain. These three go together a lot. This one in particular, I love this one. Wind pain means I have a pain here next week. Oh, now my neck is hurting me. Well, my shoulder's fine. Oh, now my back hurts. You know, what's going on here? Why is it that 1 week I'm fine, next week I've got all this pain? That was characteristic of me. I couldn't it drove me nuts, and so I would try and treat it through Chinese principles. My neck would lock up on me, right? My back would lock up on me. You know, sometimes there'd be a cross where you feel both going on, but it's usually then one goes away and one stays there. And all of a sudden that goes away, and now all of a sudden I have a migraine, okay? Wind, another characteristic of wind, by the way, a stroke. Comes on suddenly. Okay, it just all of a sudden affects the body. So you think of wind, you look outside, you see a tree, and all of a sudden the wind blows, we don't see it, but all of a sudden one side of the tree starts shaking, then the other side of the tree starts shaking. That's the concept of wind too, where things just appear suddenly. Dampness. So the easiest way to explain this, how many of us, have pain when it rains outside? Oh, I've got an aunt who could tell the weather because that front's moving in, and we call up Aunt Betsy, and Aunt Betsy says, oh yeah, expect a lot of rain today. That's coming through. Dampness can also take on other characteristics in the body. So you see some people that have a lot of water retention. Okay, that's dampness. We need to resolve the dampness. Physical trauma. So now physical trauma, and this is asked a lot, saying, yeah, but I fell down, I broke a hip. Okay, what does that have to do with wind or whatever? Well, physical trauma, what happens? Will cause blood stagnation. And blood stagnation, obviously causes pain. Physical trauma is a big source of the pain that we see today. Obviously you're in a car accident, you fall down, that obviously is a big source for pain. We have cold pain and hot pain. So a good example for cold pain would be, let's go back to arthritis, where your joints ache, but it's relieved by warmth. Hot pain, my favorite example is rheumatoid arthritis. The joints all of a sudden become achy, red, inflamed. That's how we know we're dealing with, with cold pain. Cold pain could also, or hot pain, cold pain can also be associated with a woman's menstrual cycle. She has a period, but she's in such severe pain, the only thing that relieves it is heat. She needs a lot of heat to help relieve it, help penetrate deep into the body. So let's take a look at, well, how is pain formed in the body from a Chinese perspective? These two quotes I love. If there is free flow, there is no pain, and blood flows where energy leads. This is actually my favorite quote in all of Chinese medicine. It makes so much sense. How many people here meditate or have ever meditated? Okay, great. How many people have had acupuncture? Besides my patients, but I know that. Okay, good. So something that they teach us in school that we don't really talk too much about with patients is when we needle someone, it's our intent. What is our intent when we put that needle in? It's going to affect that patient. And for a while I was like, yeah, okay, that sounds good. Just teach me the points, let me do it. I found, no, that's not the case. It really is intent. So when meditating, when you want to calm the body, relax the body, and I know you're much more of an expert on this, but if you have too much intent, you focus too much on a part of your body, chi and blood, everything's going to stagnate there. So if you're doing a basic relaxation where you're starting from the head, working all the way down, and relaxing yourself, and you're like, oh yeah, I've got that tightness right here. Well, let's spend a little bit of time breathing through it and working through it, okay? Some people can become obsessive about it and focus too much on it, and it's going to stagnate, okay? Well, if chi starts to stagnate, what ends up happening is blood starts to stagnate. So chi is the energy. Think of chi as like it's pulling this blood through your body. And if it's weak, it's not going to be able to push it and move it, okay? If it gets stuck somewhere, the blood's going to get stuck somewhere, and hence that's where you're going to get the pain. So what are the effects of chi and blood stagnation? Well, this is a real simple analogy. Think of this as like, a channel running through the body. You could think of it as like an artery running through the body. Think of this as like an organ in the body or the spine in the body. If you have free flow and everything's going fine, plants being watered, it's going to thrive. Wherever there's stagnation going on, okay, the areas of the body aren't going to get the life force that it needs to keep going. And life force, meaning blood, meaning energy, chi, all that, it's not going to get to where we want it to go. So now we're going to start talking about what we call the spirits of the body and everything. And we're going to talk a bit about shen. And shen is the spirit, we say, of the heart. Shen is also a broad term. So you've got these 5 main organs in Chinese medicine. I listed 4 of them that we're going to go over. I didn't go into the spleen because there's a lot of overplay on it. But basically, we say shen is the governor of all of the organs of the body and governor of all the spirits of the body. It's the sum total of everything. There was a Taoist sage, Chengzu, who describes the heart as a reflecting pool. When this pool is calm and still, it is the mirror of heaven and earth, the glass of 10,000 things. When you meditate, what is one of the hopeful goals of meditation, right? Is to empty your mind, empty everything, and have complete stillness. Okay? When you're calm, when you're quiet, your heart, where the shen resolves, it's like a mirror. So imagine being at a lake, you see a mirror, you know, a lake that's no wind, okay? It's a mirror. You can see the mountains reflected in it. You can see the trees reflected in it. That's how we're supposed to be. In a perfect world, this isn't a perfect world. There aren't unicorns and rainbows and stuff every day, you know, but we can still strive to be to that point and learn to let things go. The heart is the residence of the mind, the shen, like we talked about. The shen is used to indicate the whole sphere of emotional, mental, and spiritual aspects of the human being. It's the sum total of everything in the body, all the emotions, all the thinking. And by the way, the brain doesn't exist in Chinese medicine. The brain is what we call a curious organ, or we also call it a reservoir of marrow for the kidneys and bone. All the emotions, all the thought processes are assigned to the different organs in Chinese medicine. So when you come in and see someone like myself, the reason why I'm asking you all these questions is what I'm actually doing is I'm trying to figure out which organ of the body there's a disharmony in and how I have to treat it. Okay? And not just with acupuncture, but with lifestyle changes, specific herbs, all this all falls into place for it. So the 5 functions affected by the state of the heart: mental activity, such as all emotions; consciousness, which is really important because now we're talking more about the conscious mind, and we'll be talking later about the subconscious mind; memory, thinking, sleep. So let's talk about some of the main organs involved in all this. Heart disorders, we call them shen disturbances. So I'm going to start with the spirit level first, because the spirit level really guides what goes on physically with us, all right? It's like our intent. And a lot of times we've been programmed so much that we don't realize we do things the way we do or the way we respond to things because it's so deep-rooted in the spirit. And so when we look at the heart and whatnot, usually, you know, they don't have much soul to life. They can't tell what's right for them. They're ambivalent. It's like, oh, there's no passion. You know, there's no joy. Joy is the emotion of the heart. Too much joy is a disharmony, though. And people are like, well, how can you have too much joy? How can that be bad? Okay? Well, the best way to describe this is, you know, if you ever look at the old movies, let's say in the 1930s and 40s, and you look at people who would be, back then, the term was insane asylum, they always show them like laughing crazy, right? It's too much joy. It's the heart fire, we say, it's just blowing up, and it's like, oh my God, I'm just like, you know, I'm in your face, you know, laughing a lot. So some of the physical symptoms are, well, we see mood changes take place in people, you know, going back and forth, emotional roller coaster. They're like up and down, up and down. Anxiety, depression. These two go hand in hand, okay? Panic disorder, and of course I have anxiety twice. I really want to hammer that home because it does play a key role. Fatigue, but this one I love, wandering joint pain. Remember we talked about wind? Okay? Liver. Liver is an interesting one because almost or just about everyone in this room has some kind of a liver disorder. And I don't mean don't run out to your doctor and say, oh my God, this guy said I've got a liver disorder, we got to go get it checked out. But from a spirit level, if you're just really timid, you don't have much direction, you know, Obsession with injustice. I love this one. This, I think, is good. The rule followers. Okay? It's got to be this way. Okay? It's black and white. They won't bend. Some of the symptoms, of course, crossover. There's depression. It's what we call liver qi depression, liver qi stagnation taking place. Erratic emotions, repressed emotions. You know, you hold them in, and it creates what we say this liver fire, this depressed liver heat that takes place in the body. And so some people who've got migraines that just flare up, red face and everything, liver fire. So we need to anchor it. Digestive issues, emotional issues. This I really like. I see this constantly in clinic. A good way to describe it is if you get stressed out or emotional, your stomach hurts. You can't eat. You have no desire to eat. Some people are great. Some people are the opposite. Oh, no, not me. I could eat when I'm emotional, when I'm stressed out. Well, people like myself, no, I don't want to see anything. I can't even think of food until the problem is resolved for me. Outburst of anger. Liver opens up into the eyes, the red face. You know, it's they can't control that temper. Liver qi stagnation, the biggest cause is unfulfilled desires. So think about that. The desire to be successful, the desire to be liked, not getting what you want, okay, no matter what it is, whether it's a good intention or a bad intention. You know, liver qi stagnation. You're a student, you're working in class and you want that A. You don't get the A, or you're worried about getting this, so you're giving yourself migraines or neck pain all the time because your desire is being unfulfilled. Woman trying to conceive, I see this all the time. Unfulfilled desires. Kidney disorders. Z is the spirit, okay, of the kidney. Lack of heroism, absolute despair. But this one I purposely bolded. Inability to face fears, which interferes with our expression of true self. So many people live life in fear. It limits them, okay? The real you isn't expressed out. This is really important. The kidneys are in charge of reproduction in Chinese medicine. The kidneys are in charge of your immune system in Chinese medicine. The kidneys have yin and yang, fire and water. So as we age, we lose some fire, we lose some water. For women, they lose the water first, hence you see the menopausal symptoms, hot flashes, night sweats, you know, dryness. Men, they tend to lose the yang first, and hence, you know, you see, you know, certain libido issues in men. You see quicker fatigue, harder to put on muscle. Kidneys are a big deal, obviously, in Chinese medicine, but fear is the big emotion in Chinese medicine. Think of when you get scared, you know, you get scared and you wet yourself. It's the kidneys. They're not strong enough. Lack of willpower, sexual disturbances, sleep disturbances as well. The yin isn't there to calm you at night, relax you, quiet you. There has to be that balance between fire and water. The lung, which is the Po, is the spirit. Pain over the whole life, you know, so your whole life you've always had pain. You've had to deal with some pain and whatnot your entire life. Extreme sensitivity to negativity. People, the emotion of the lungs is grief, by the way. And people can't take anything negative. They overreact a lot, okay? That's how we know we're dealing with a lung disorder when we talk to people. The common symptoms, of course, are obsessions, depression, you know, OCD tendencies, things like this. Chronic tension and pain, you know, especially over the span of a longer time, we'll see that. And again, these are, if it starts off here, the chronic tension and pain, it's going to end up leading, because this is an energy, to liver qi stagnation, right? And when liver qi stagnation keeps going, what's going to end up happening, you're going to have blood stagnation. take place. Asthma, obviously because of lung, but you can have kidney asthma, okay, because the kidneys help anchor the lung and pull it down when you breathe. I have a patient now, she's about 78 years old, she's in from Bulgaria, and she has COPD. And of course you want to treat the lungs, but really I'm treating her kidneys. And her daughter was telling me that she was outside playing soccer with her grandchildren the other day. She's able to breathe much better. So what are the Western equivalences of Shen disturbances? This is where I want to start kind of tying things together a little bit. So some of the Western equivalences are what they call tension-myoneural syndrome. Mind-body syndrome is what people hear most about. Tension-myositis syndrome. You lump this all, we could say psychosomatic disorders. I'm always nervous when I talk to a patient about pain, mentioning the phrase psychosomatic disorder. And the reason why I'm fearful, and coming back to my kidneys, is because I don't want the patient thinking that I'm saying, well, it's just in your head. You know, that's just dismissing them. That's just dismissing what's actually going on, you know, in their body. Yeah, it's in their head, but it's in their body. And it's all legitimate. Everything is absolutely legitimate, right? We're trapped in these vessels, okay? So we have to learn how to work and deal with it. There was a Dr. John Sarno, who I've read all of his work. I've read about 17, 18 books on this topic because it fascinated me so much. This is Chinese medicine, what he talks about here. And I'll get into some quotes and everything in a little bit. But he was a pioneer. He was, I think, 94, 95 when he died, and talking all about how the mind and the body are connected. They're one, you know, and how to face fears and deal with pain and everything. And now, because of the opioid crisis, doctors don't have much in their arsenal. They're now going to his work. Whereas before, it was big business for them, right? And don't get me wrong, I'm not saying that people may not need a pain med or that people may not need a surgery. Absolutely, you do. And there are times I refer patients saying, you know what, you really need the surgery. You know, we've done everything we could for you. You've done the work, and for some, they need it. And it's life-giving. It's, you know, it can really help them. The way I look at it all is the subconscious mind. As you know, you got the conscious mind. I'm talking to, I'm conscious. The subconscious mind is driving me. It's the sum total of all the spirits we talked about up there. Okay? That's what brings us to our conscious. It's kind of like all these little voices, all these little organs are talking to each other, and the governor, the heart, is saying, okay, I'm going to take everything you're saying, and I'm going to make it rational for this person to deal with and how they interpret it. So what is mind-body syndrome? Well, basically, they say that there are three main emotions, okay, that the subconscious mind holds on to and deals with ever since birth. Fear, grief, and rage, okay? So you think about the organs that are involved with that. So what happens is the subconscious mind shuts off blood and oxygen to tendons, muscles, and nerves, and creates pain. This is a very simplistic view. I mean, I could honestly teach an entire class just on this. Well, why would it do that? Well, it shuts off all this stuff, creates pain as a way to deflect us, refocus us, okay? It's not uncommon that, you know, I'll talk to a patient and they'll be like, yes, but, you know, I injured myself. You're 100%, you injured yourself. I'm not discounting that at all. We treat the injury. The body, again, is dynamic. It heals itself. And sometimes it doesn't heal us perfectly like we would like, okay? We get operations or we're sent to physical therapy And, PT can only do so much. Also, the responsibility of the patient of not following through all the time on the PT and keeping it going and whatnot, that's going to affect us as well. But it's great at refocusing, really good at refocusing us. I like this quote, often rooted in depression and anxiety. Anxiety is an equivalent to pain, and pain is the anchor for anxiety. It's kind of like this dog chasing the tail kind of thing. If he doesn't deal, he will ultimately feel. This is from one of my favorite books, The Great Pain Deception. This completely changed my life, this book. I recommend it to most of my patients. It's not an easy book to read for some. It goes pretty deep. We're going to go into that in a little bit about self-help and everything. But in most of these cases, most people who deal with this and struggle with this, there is some anxiety, there is some depression without a doubt. They go hand in hand. It creates pain, and the pain itself can create anxiety. Think about it. When you're in pain, it's a struggle every day. And you think to yourself, my God, is this how I'm going to be for the rest of my life? I'm this age now, and I'm going to be like when I'm 60, when I'm 80, when am I going to be wheelchair? Your mind goes, and it goes. And it's doing this, and the deeper you start going down that dark rabbit hole, what ends up happening is you're not thinking about your marriage issues. You don't have to think about, making the bills every month. Your child's off doing drugs and you're worried about your child, it's a great distraction. Or even good stuff. I'll tell you, when my back's going to really start aching me, when I'm planning a vacation. Isn't that crazy? Think about this. You're planning, it's like a happy time, okay? I can't wait to get away. For me, it's too much. I'm running an extremely busy practice. Now I have to set up file folders for a week in advance for 200 patients, write notes for the acupuncturists, that are going to be covering my patients for me. When do I pack? I'm usually packing the night before, 2 in the morning, trying to get everything together. In the meantime, my mind's also going of what everything I've got to get done and do. While I'm treating patients, I'm okay, I got to remember to pack, my shoes, my running shoes, or this or that, because of just time, okay? Certain personalities, which I didn't put in these slides, are actually affected more by others with pain. Typical type A's. People who are introverts a lot of times will get it, okay? Because they're pushed into things that they don't want to be. The do-gooders, the rule followers, all right? They're going to be hit, with that. People who put themselves under too much pressure to be perfect and good all the time, or acceptance of others and stuff, that's going to be, they're going to be affected. People who can't say no, all right? People pleasers, who can't say no, People who don't like confrontation. Common one, absolute common one. So I wanted to talk briefly about some fast case studies and give you an example of how all this kind of fits together. And I had a doctor a few years ago came in to see me. He brought in his wife because he couldn't talk. And he had a laptop. And does everybody know what a uvula is? That funny little thing that hangs in the back of your throat? Well, that was swelling. His throat was hurting him to a point where he was just basically eating water and a basic liquid diet because the pain was getting so bad. This poor guy was losing weight. At one point he was thinking, I'm going to have to be put on an IV. He's been to Mayo Clinic. He was at University of Chicago, Northwestern, and I don't recall the other clinic he went to. And I got to talking to him and doing a whole health history and everything. And one of the things I talk to people about is I ask them, well, what was your childhood like? I want to find out, what their childhood was like. He told me about, about his whole, childhood, but he doesn't really have much of a relationship with his dad, okay? In working with him, I started working with him, and he was getting better. I was doing local points around the throat and other points. We saw, a little bit change and stuff. I brought him in to talk further about him, His wife, of course, is there because she is typing the answers of what he would say because he really couldn't talk. He didn't want to talk. It hurt too much. Well, come to find out, he was offered a premier job on the East Coast, running his own clinic. And he really wanted to take it. And at the same time, he had just started a relationship back with his father. That's when his voice started going, okay, and when the pain and everything started happening in his throat. And he told his father about this great promotion he was going to get and run his own clinic. And he was looking for the acceptance of his dad. His dad looked at him and said, if you go there, the relationship we have is over with. So him being the good son, and everything, and wanted this relationship. And by the way, the heart opens up through the throat, okay, in Chinese medicine, or actually through the tongue, okay, and the mouth and uvula and all that. It all clicked. So I said, all right. And I go, well, here's what you got to do. And I started talking to him about visualizations, about this, and I gave him some books to read, and I hooked him up with this very specific doctor who dealt with TMS. We still treated him, to keep him calm and whatnot. And one day he shows up in the office because he was gone for about 4 weeks or whatever. And one of my staff members grabbed me and they go, Dr. So-and-so's out there, wants to meet you. So I walked in the waiting room and he starts talking to me like I am. And he starts crying and gives me a big hug. And he goes, I'm moving to the East Coast. He had told his dad he hadn't had the kidney strength, the fear, faced his fears. He told his dad, look, I love you. I want to have a relationship with you, but I got to live my life, You die tomorrow and I'm living your life. I'm not happy, so either support me as your child or not. And it changed him after that. I was really happy to hear that. This next one is a tough one. I had this beautiful 80-year-old woman come into my clinic, came in with a walker, sat down in front of me, and just started crying. And she goes, you're my last hope. And I said, how so? And she goes, I've been in severe pain for over 25 years. She showed me her MRIs and everything, multiple back surgeries, neck surgeries, screws, plates, everything. And it didn't fix anything. She just kept getting, the pain just kept getting worse and worse. What ended up happening was she was on some type of opioid, fentanyl patches, everything for those 20 years, trying to control the pain. It wasn't working. Did an intake on her, asked her about her personal life, about her family life, and grew up in the Depression era and whatnot. And because it was a tough childhood, it was a rough childhood. We didn't have much growing up. So I started treating her, and by about the second treatment or so, third treatment, she was getting better, but I had told her, I said, I want her reading, this book, The Great Pain Deception, okay? And I mentioned another book to her too, but I didn't think she would be able to read that book because there's a lot in that book. About a week later, she comes in and she's laying on the table and she goes, I'm reading that book. And it's interesting. It's making me think about a lot of things. It's bringing up things that I thought I forgot about or wanted to forget about. And I said, yeah, how so? And all of a sudden, she got really quiet before I needled her. And she goes, that's funny. I go, what? She goes, I thought about something that I really forgot about or wanted to forget about. And she starts telling me about when she was a child, she would help family members, help her in the basement, load up wood into their furnace. And then afterwards, and she was about 10 years old at the time, afterwards, how she was raped by family members. It just came out. She started crying and crying. Of course, I'm crying because I'm watching this beautiful 80-year-old woman crying. And kind of held her and talked to her and walked her through, all this. Put the needles in her, let her relax. The next week she comes in, and she comes in without a walker, without a cane, and she's standing there, and she starts kind of dancing, and I walk out, what's the matter? She goes, look, she goes, I have no pain. She goes, I haven't been on a pain med in a week. She faced her fears. That's what a lot of this is. We bury. We don't want to go to that dark place. And it's scary. You know, and I'm not telling everyone to go out there and go do it today. No, sometimes you have to do it in little increments, you know, little increments. Remember we talked about another slide about expressing your true self? Your true self is buried. That inner child is still buried, okay, because of traumas and everything that we've been through our life. So how did I become pain-free? Well, you want to talk about being a type A person, okay? Afraid to fail and whatnot. I have to prove to the world that, you know, I can do it. I can do it. I don't care. I don't care about my size. I'll go in and fight that guy who's twice my size, you know. In school, you know, wanted to be tops in the class because there was this inner need, inner desire that was missing in me that always was told, well, you're not good enough. Treating a woman, an attorney, very high-strung for severe vaginal pain. Couldn't have relations with her husband. And she starts, you know, I'm treating her and everything. She's getting better. But she starts telling me about a pain clinic she wanted to visit. And I'm thinking, oh, this is a whole pain clinic on just drugs and stuff. Looked at it, researched it. After she told me about the whole program, I'm going, oh my God, this is Chinese medicine. It wasn't Chinese medicine, but this is Chinese medicine. And it was basically dealing with what Sarno talked about in his books, the mind-body syndrome. I literally called them up, said, get me in. It was like a 3-month waiting list. There was a particular doctor out of Northwestern. He's no longer there. He's independent now. Did some research. That's how I ran across this book and ran up a couple books. So me being type A, I had to get the books, read about it, learn about it. I wanted to become the expert on this because also I figured I could use this for my patients, okay? By the time I saw him, about 85% of my pain was pain-free. You know, I was pain-free. He saw my MRI and he goes, yeah, I'll agree. He goes, this is one of the scariest MRIs I've ever seen. He goes, this is a scary MRI. He goes, do whatever you want. Don't worry about it. Don't worry about it. So applying the principles, you know, treating myself differently, using a lot of heart points, mind calming points, facing stuff I did, and the way he explained it's a good point. Everybody's born with a different size cup in your life, okay? Some people have really small cups, they can't handle a lot. Some people are born with large cups. And he goes, Pete, he goes, you were born with a cup like this. And he goes, but the problem is your cup was 3/4 full by the time you were a teenager. You know, when I was a teenager, parents were divorced when I was, well, before that, my parents were divorced when I was 4. Lived with my mother, my grandmother, my sister, you know, no child support. That's childhood abandonment. That's a big one, a big one. Remarried, you know, going through, you know, school. Of course, I had the physical trauma, everything that took place. When you have a physical trauma, what ends up happening is there's a neural connection that your brain right away says, we got to fix this. There's something going on here. Body repairs it. But what ends up happening for a lot of people, that neural connection still stays there. Okay? So now, in times of grief, pain, sorrow, you've got too much on your plate, it's gonna activate it, and it's gonna say, okay, let's turn this on. Let's refocus him. And so you think, oh, it's that old football injury I had from when I was a teenager. Now I'm 55, okay? Body's healed many times over, but that's how this works. You have shen disturbance, we call it. It doesn't mean you're crazy, all right? It's just, hey, you got a disorder going on with an organ. You know, let's address it. Let's fix it. Let's look at what emotion is really taking place here. Let's look at the pain. Where did this start? How did this become, you know, chronic like this? This is kind of how we meld the Western with the Eastern on everything. So when we gain the strength to face who we are and how we react to life openly and honestly, pain and illness have few places to hide in the body. From the Great Pain Deception again. Love this quote. It's so true. Once you start ferreting it out, and I've got news for you, once you start facing it, don't be surprised if all of a sudden the back pain goes away, but now that neck's going to act up. Or now that shoulder's really going to act up. Or a pain that you haven't had since you were a teenager is now going to come out, like you get TMJ or something. This is very common. The body does not want to give up this defense mechanism, okay? And it may never totally give it up, and that's fine. Even Cyril talks about he had pain, he had issues, he would get acid reflux at times and whatnot, and he'd have to figure out what's going on, but that's okay, but don't fear it. Never fear it. All family relationships are emotionally loaded. It is one of the first things to be considered when someone has an attack of TMS, tension neural syndrome, that seems to come out of nowhere. Family relations. All the time I look at them. One of the biggest times we see a lot of issues is Mother's Day. Relationships with mothers, missing their moms. So when pain's going to act up on me, it's usually in January, right around January. That's right when my mother passed away. I was in charge of her estate. And the last time my back went out on me, it was a Tuesday. I was getting ready. I was at the sink, and my cat came up to me and jumps up and puts his back paws on my leg, and he's hitting me. He wants me to play with him. So I'm like, all right, I'll give him a minute. Bent over to pick up a string, heard a pop, dropped to my knees, full-blown spasm. I mean, I couldn't even breathe. And I laughed. And I honestly laughed. And I'm going, I know what's going on here. Stood up. That whole day was a rough day because I had to be in my Wheaton office. Then I had to drive to my Joliet office and work there till 10 at night and come home. If I leaned this way, the spasm would get really worse. But if I leaned this way, I could stretch out the muscle, oxygenate it. I know the spasm would be better. So when I work on patients, which way do you think I lean, to the left or to the right? If I lean to the right, the spasm was better, right? I leaned to the left. I wanted to hurt. Why was I doing that? Because I'm taking command of my body. And I said, no. No, Shen. No. Heart. No, 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 no. I'm in charge. You little guys that are in there are not in charge. You can't fear it. So what happens is when people fear the pain, fear the, having to go through it, they don't want it, they don't have the energy to keep pushing themselves through life. Face it, face it. So how do we treat this? Well, these are the different ways we treat it. Acupuncture, direct or indirect treatments. Direct means if you have neck pain, I put the needles into your neck, we treat it. Indirect, which is what I typically use more for pain, is points that I'm going to use. So if you have neck pain, I'm going to treat your hand, for instance. It's a great refocusing technique. We're still getting blood flow to that tissue. Okay, it's still releasing painkillers in the tissue. Sarno and all the books will tell you don't get chiropractic, don't get acupuncture, don't do exercises specific for back pain, because all you're doing is you're telling your body that, hey, there is something wrong here, so address this, address it, address it. It's going back to, remember when you meditate and you focus too much in one area, chi stagnation. Chi stagnation causes blood stagnation. We become obsessive. Lower abdominal breathing is one of the easiest things we can all do. And one of the things I recommend, and if some people, if you're more comfortable standing up, some people want to stay seated, it's going to look like this. The chest never moves. We don't ever want the chest to move, but the belly moves. So it's basically breathe in and out. That's it. In and out. I tell people, I want you to train yourself so 24/7, this is how you're going to breathe for the rest of your life. If you're in your car driving, how you know you're doing it correctly is your seatbelt should get tight and loosen, tight and loosen. You're on a conference call, you're watching TV, remind yourself, no, I got to breathe, I got to breathe. Well, what does that do? It relaxes the sympathetic nervous system. Sympathetic nervous system takes you out of fight or flight. You're out of fight or flight, you have more blood flow to the areas of the body. Get angry, take control of your body. Sarno talks a lot about this. Steve Ozanich talks about this. Other people talk about it. Sometimes you just have to get angry at it and scream at the pain, either verbally or internally, to tell it to go away, and talk to it, talk to it, talk to it. Visualize before, during, and after sleep. This is one of my favorite things right here. I tell patients, go ahead and, at night as you're going to bed, I want you to start visualizing a lot of blood flow going to that affected area of the body. And I want you to imagine every detail possible, doing everything you would typically do if you weren't in pain. Okay? Make it as detail-oriented as possible. That is absolute key in what you do. So, if you imagine that, God, I love golfing, but I can't golf because I'm in so much pain, imagine yourself on the golf course. Imagine what the course smells like, what the green looks like, what your favorite hole is on the course, picking your favorite club and swinging effortlessly, and you have no pain whatsoever. You go to sleep and you wake up in the middle of the night and you're turning or whatever, go right back into the visualization. Keep saying how good you feel, imagine the blood flow. And the same thing the first time when you wake up out of a sleep in the morning. And the reason why I'm saying this is, has anybody here ever had hypnosis? Okay, so they deal with the subconscious mind, and what do? Well, they want to get you relaxed so they could imprint. And that's all you're doing is imprinting, imprinting, imprinting. I had the fortunate opportunity of treating tons of Olympic athletes, professional athletes, and I'm fascinated. I ask them, I go, what separates you from a medal winner? What separates you from a professional? And they said, this. That's it. Just getting in someone's head. That's all it is. All it is. An old movie I've seen multiple times, a documentary, is called Pumping Iron, about Arnold Schwarzenegger. And this is what he would do. The people who would room with, he would just get in their heads, just mess with them just a little bit. Because he knew that if they're standing on stage, they would have just a slight self-doubt and it would come out in their poses. The guy was a genius. I loved it. Face your fears. Oh, sorry. Face your fears. Don't be afraid to face them. And if you need help to face them, work with somebody to face them. Journal. This is also good for a lot of people because you're putting your emotions out on paper. And for some, they could even make a ceremony of them where they could burn them, throw them out, shred them, and it's gone. Move, move, move. I want you exercising, moving. Don't be afraid. Our bodies are designed to move. I'm not saying to go out and start a powerlifting class tomorrow, but move. When we don't, we stagnate. And this, I think, is one of the biggest things forgive and live life. First, start with forgiving yourself. You can't forgive others if you don't forgive yourself. And then forgive those who harmed you. It's hard. It's really, I'm not saying you can do it right away, and you may never be able to do it. Everyone's different. But forgiveness is huge. What I included on there and on the handouts and everything, and thank you for the Theosophical Society for printing this off for me. These are some main points that we hit on the body, okay? You could massage them, okay, up in the ear, shen men, that's a good mind calming point. There's a point, shen men, heart 7, we call it, right here. Tons of scratches. I have new kittens, so they're attacking me constantly. CV17, I love this one. It's right here in the center of the chest, right in between midline here, about the 6th intercostal space. I tell patients, go ahead and massage it. Massage it, You're stressed, focus on this and massage it. We talk about breathing and breathing in and out and relaxing. Breathe into these points. Breathe into this point. Breathe into this point, especially yin tang. Yin tang is a great mind calming point. Some people call it the third eye. Relax and breathe into it. Breathe in, breathe out. It opens up the heart. Open up that chest. Okay? This point right here, lung 5 in the crease on the side by the thumb. Okay, you'll see a tendon right in here. It's on the outside. This is a big grief point. Huge for grief. So if I know people are going through specific grief, massage it, work it, breathe into that point, okay? It's also okay to go ahead and massage the whole body. Work the channel, work the whole ear. You could treat the whole body just through the ear itself. Give yourself a self-massage in the morning. When you wake up, wake yourself up. In the shower, go ahead and just spend, 60 seconds putting pressure on all these points. Some of the resources I put down just quickly, Healing Back Pain, Dr. Sarno, love it. The Great Pain Deception, written by Ozanich. 5 Spirits, this book really recommend it. A lot of the quotes, a lot of the stuff I put in here about the organs are all in here. She's an acupuncturist. I know her, wonderful woman. They get deeper into the energy spirit level and the alchemic use of how we use acupuncture. Can't recommend it enough. I know I talked to your bookstore about bringing in some of these books, so I think they may have. I looked on the table. The book that inspired me to get into Chinese medicine, they have the complete book of Chinese health and healing. I have actually 2 books, because the first book I used so much it just broke apart. I absolutely love that book. Highly recommend. Check it out from their library. And Daniel Reed's stuff. The first book I had to read on Chinese medicine is The Web That Has No Weaver. I see you have it too. My woman I apprenticed under made me go ahead and outline it. And then look on YouTube. There's a video called All the Rage. It's a documentary about Dr. Sarno. Really good documentary. Love it. All the people in the documentary are patients of his, so you'll recognize, you know, people like Howard Stearns in there, Larry David's in there, and whatnot. So thank you for your time. I appreciate it. Hopefully you picked up something. Please, I love questions, and ask me questions. Does anybody have anything?
Thank you, Peter. And yes, we have time for questions. However, I ask that if you want to ask a question, please raise your hand so that we can record the question as well as the answer.
Is there any parallel with or any association with what the chakras? I mean, there's like the 7 chakras,
Yes.
and they talk about energy flow through those chakras, and where they get stuck, you can
Yes.
creates pain.
So and I'm not an expert on chakras. I'm going to say that now, but if I had a chart here showing acupuncture meridians and everything, the chakras correlate a lot to the Renmai in Chinese medicine, the Du-Mai in Chinese medicine. The Renmai is called the conception vessel. It starts in the perineum, okay, which would be the root chakra, and it runs all the way up to the crown of the head. Well, it stops about here. The Du-Mai runs from the tailbone up the spine to the crown of the head and then stops here. So you have the crown chakra. So there is a correlation between the two, kind of loosely, you know, you work them. So if I work the crown, I'm working the crown chakra, but it's due 20 in Chinese medicine and whatnot. So when we affect these things, we're affecting also the chakras. We're looking for stagnation, much like they do in Ayurvedic medicine. And
going back to direct versus indirect treatment, how do you make that determination as to what might be best?
That's a really good question. When I started changing up how I started treating people for pain, I remember when I was talking to this doctor, he goes, I love acupuncture. I believe in it. He goes, I have acupuncturists that work for me and everything. He goes, but I can't refer to acupuncturists who, for my pain patients, because it goes against the principles of, well, if we keep treating your elbow pain, well, then yes, there is something wrong with it, okay? And especially I love when people wake up and I just woke up and my back's out, okay? My God, what did I do? And they get an x-ray or they get an MRI. Well, that's because you have a bulging disc. Well, your disc didn't bulge when you were sleeping. Okay, your subconscious mind's waking up and it's replaying all the stressful events. So I looked at him and I said, give me some time here, because I was having huge ethical dilemma in my practice going, all right, I feel great. Do I treat this pain directly or not? And if I don't, well then I could lose my practice and stuff, but I go, no, this doesn't make sense. So I'm trained in about 5 or 6 different styles of acupuncture, and I started using indirect treatments, going, let's do this, let's refocus, let's focus on that, and then we focus on this, and this. And that's where we saw the changes right away with the patients. Now, some patients need to be treated directly. And I could usually tell when I'm talking to them what their personality's like. A lot of times, you know, some people just think, well, he didn't really treat me because my pain's here and he's treating this part of my hand. You know, what's going on here? And I'm going to know within a couple treatments if a distal treatment's working or not. And a lot of times when I work on somebody, I'm usually incorporating 2 or 3 or 4 styles at a time with somebody, you know, because I don't want to waste their time and money. But in most cases, you know, I can tell, I'll know. And a lot of times if they come in with a headache and I do 1 or 2 points right away and it relieves it, I go, yeah, I know what's happening here. And so that's how I determine. In just years, I've been doing this about 23, 24 years, licensed about 15, 16 years, and you just kind of know. Any other question? Yeah.
So when you were talking about the disorders of like the liver and the kidneys and things, I wasn't quite sure. You're not really talking about physical disorders of those, like you don't have like a liver infection or something like that.
Right.
Or
Right.
it's where it's a disorder of what, like.
So in Chinese medicine, you hit on a good point. If I tell a patient that, well, you know, you have a kidney qi deficiency, okay, or liver fire, right away they're thinking, oh my God, my kidneys failed. But you can have kidney issues. So you can have the physical issue of the organ itself, okay, but you can also have the energetic issue of that organ. So if someone's frightful and fearful, when we know they have a kidney insufficiency, we have to strengthen their kidneys. You know, if someone comes in with a reproductive disorder and, you know, I know it's strongly related to the kidneys, okay, a woman comes in with menopausal symptoms, okay, and a lot of dryness and hot flashes, well, I have to help the kidney into the body, the fluid of the body, to keep the fire in check a little bit, and so we're going after it that way. You can have both concurrently together, but we look at, well, what are the physical manifestations that this person's exhibiting when we treat them? You know, and that's why I ask all those questions, because I'm trying to put them in saying, okay, if you have a heart disorder, oh, you've got a lot of anxiety, odds are it's a heart disorder, okay? If you're having insomnia, it's probably a spleen disorder, you know? But the spleen and the heart work together. This is where it gets more convoluted, you know, so to speak.
And the disorder is the energy
is the
disruption.
issue you're coming in to see me for. Okay? That's exactly right. It's the issue you're coming in to see me for. You know, so if you have digestive disorders, I'll probably first look at the spleen. Okay, but then I have to look at the liver, because if you're a stressful person, well, the liver is also known as the mother organ, the spleen is the child organ, and the parent organ can overbear on the child because maybe the child's too weak. So when you get stressed out, you don't feel like eating. So a lot of people are like, oh, well, then we got to strengthen that spleen so it can handle that. Well, you can strengthen it all you want, but if you don't pacify the liver, it's always going to be too overbearing on that child. The spleen.
There's a question from someone who's watching through the internet. Can you elaborate on what TMS is?
So TMS stands for tension myositis syndrome. Some people call it tension myoneural syndrome. That's a term that was coined by Dr. John Sarno. That's when we talk a lot about psychosomatic disorders, mind-body disorders. That's really what TMS is. I know if you look up TMS on the internet, it'll come up something about magnets or whatnot. So that's really, really what it is.
Now, I know you might not be able to answer this, but who are some of the athletes that you've treated? Some of the famous
Yeah, I
athletes?
can't give that out.
Oh,
That's
darn.
HIPAA.
Gordon, come on.
HIPAA, I can, HIPAA. HIPAA.
Thank
Some
you.
of them, you know, there's a couple of them, you know, but otherwise, yeah, there's been quite a bit.
I'm curious what your practice, how do you incorporate herbs or nutrition or other aspects of the health?
So when a patient comes in, we assess them. Not everybody gets herbs. Everybody gets nutrition, okay? Because remember, if you go back to that first slide when they talked about the inner body being strong and constitution and everything, well, it's a lot more than just treating the mind all the time, too. If you're not taking care of yourself physically, you know, and eating properly, well, then you don't have the energy to get better. So when a patient comes in, we do an intake on them, and then typically second or third treatment, we sit them down, and that's when we cover diet with them, tell them what type of vitamins or supplements or nutraceuticals I think you should be on. And then if they need herbs, then we put them on herbs. You know, when I do a lot with fertility, we're doing things to help with egg quality, helping with blood flow and whatnot. When we're dealing with, you know, pain, I don't give a lot of herbs for pain because we've had a lot of people get better now without needing the herbs, but there are some that need it. We have patients that have, you know, hip replacement, you know, knee replacement, so we treat them afterwards to help them recover quicker, you know, after the surgery. So yeah, for that we'll probably, you know, put them on herb formulas and everything for it, migraines, digestive issues, that kind of stuff.
Lately, CBD oil is being used a lot.
Mm-hmm.
What's your take on that?
I'm asked this question in fact, I was probably asked this question at least 3 times today. I'm not an expert on CBD oil. I don't really have too much of an issue. The only time I have issues with like the latest trend is when it becomes a cure-all for everything. Pain, I do know it's got great resources for pain, for assisting with cancer, you know, side effects of cancer, you know, trying to find a good, reputable maker of it, that's something I can't help you with. I do have patients who are on it, who swear by it, who love it. Great. Try it. You know, our health is a journey because what may work for you may not work for you, okay? And vice versa, you know, but elements of what you did may help with what she's going through. So, you know, don't be afraid to try things out. You know, and different manufacturers have different strengths of it as well, different purities, you know, as well.
No more questions? Good.
I've read somewhere, seen some videos about treating pain with fasting. So like not eating food at all for a certain amount of period, whether it's a day or a week, and how that can lead to treating particular problems that a person might be facing. If you could just talk a little bit about that.
Well, the little bit that I know about treating pain in that particular fashion, how I look at it as, especially if there's digestive disorders and stuff, if some of the etiology of the pain could be coming from bad diet or the gut isn't working properly. So then we get into like leaky gut, you know, things like this. And when you do fast, okay, like the big thing now is fasted, you know, not eating till like noon or 10 o'clock or whatever, or working out while fasting. I do that when I work out. I don't eat anything. You know, I get up in the morning and then I go straight there on an empty stomach, and you're used to it, your body's burning more fat, it's utilizing it more and whatnot. And, you know, fasting itself is very good for the body because it can detox, it can cleanse the body. You know, when people go through liver detox and stuff, this is what I have them do is, you know, I said, hey, you can even just try a water fast for a day or for 2 days, because it allows your body now, the scavenger cells, to now do more of its duty instead of taking up all of its time digesting food or bad food and whatnot. So I think that's one way that it can help strengthen the body and help it heal. You know, I don't have an issue with it. I like it.
I just had a question about for the too much heat. How do you balance that out? And which meridian is it?
Well, it depends on what heat we're talking about, because you can have heat in every channel, okay? So if we're looking at menopause, okay, or if we're looking at, let's say, rheumatoid arthritis, joint pain, everything's inflamed. We'll use specific points on the body that are heat clearing points. I had a woman come in hot, and she was more menopausal, just hot. I mean, she ran hot. She would, in the middle of the winter, would literally be in sandals, in snow, walking to her office because she just couldn't handle the heat. She'd sit at her desk. She would have fans blowing on her just to stay cool. I remember I did a treatment, and to this day it stands out. I treated her, I put the needles in her, I did all these heat clearing points, a little bit of balancing on her. I left. I came back in the room, and I remember when I opened that door, it was like I walked into a humid sauna. Just the whole room was just moist heat coming out, and she's on the table freezing. And it was the coolest thing to this day, and so we still talk every once in a while, and every time she starts to feel a little bit hot, she comes in, she only needs about a treatment now, and she's good to go. Good to go, you know. We have to look and figure out what is happening with the patient and what's happening with that particular organ or organs, because multiple times by the time we see somebody, they're already pretty far gone. We see them, we're like their last hope, and so it takes a while to work with somebody, but then, you know, we'll try and clear out the heat, but you can't clear out too much heat either. You know, it's yin and yang, it's balancing. You're going to go from here, you're going to swing here, and you hope you're going to end up somewhere in the middle.
Now, I know you mentioned meditation, but you also have your patients do Qigong or Tai Chi?
For some, yes. A lot of them I recommend. You know, I trained in Qigong and Tai Chi. I love it. I think people of all ages should do it. You know, if you're wheelchair bound, you can still do it. There's some good classes out there, you know, for movement. If you really think about what people don't understand about Tai Chi, first off, it's a martial art. Most people don't even realize it's a martial art. But secondly, it's used for medicine, and it's used for self-healing. And what is the main goal of it, right? And all the movements that they use in Tai Chi open up different acupuncture channels in the body. And it's all about free flow. And it's all based on the principles of yin and yang, soft and hard, soft and hard. You know, so I'm a huge proponent on it, and you could take that and expand that into life lessons about when to, you know, deflect and when to be hard, when to confront, when not to confront, you know. But absolutely, I love it. I think everybody should do it, especially as we age. It's going to help with balance and whatnot. Mm-hmm.
I'm going to do my best to describe a strange pain sensation, and I've never tried to describe it to anybody before, so if anybody knows what I'm talking about, please speak up.
Oh, this will be fun.
It's interesting.
That's all right.
So going back to hot, cold, wind, sharp pain, occasionally I'll get sharp pain that pulsates in two random parts of my body at the exact same time. So I'll have like a point in my foot and a point in my neck where all of a sudden they'll both, like, it's like a spiky, sharp pain, and it'll pulse a few times, then it'll go away. And then the next day is two other random parts of my body. It'll be like a toe and like my rib or something. It's just the strangest thing. And I'm like, what is the connection here? It's just 2 points, and they change. And I don't know if that makes any sense to anybody, but I've experienced that my whole life, and I can never explain it.
It makes sense to me.
Okay.
That's wind. Remember when we were talking about wind? That's basically wind, basically. But it goes a little bit deeper. I could maybe explain it from a Western point of view and an Eastern point of view, okay? So from an Eastern point of view, it's wind. The sharp stabbing pain, you're looking at, well, possible blood stagnation, you know, a little thing like that. Western point of view, sometimes it's just an odd neural connection, neuron firing, okay? It also depends on where it is. So if you describe that, you know, it started here and then I also feel on my foot, well, that could be the liver channel that's affected, okay? Oh, then tomorrow, now it's, you know, here and here, well, that's large intestine channel, you know, that's affected. So that's not uncommon, you know, we'll see that. And sometimes, you know, our bodies aren't perfect, they misfire at times. Also, you know, look at what's going on in your life at that point. You know, it's stressful. Are you thinking about too much? Do you have too much going on? You know, and then it goes back to, well, is it TMS? Is it not TMS? And this is where I struggle. This is where every doctor I know that treats the struggle is saying, well, is it mind-body syndrome or is it an actual injury or it's both, you know, at the same time? How much is one? Is it 80% mind-body, 20% injury, you know? But that would be a classic case of a wind, like a fast-moving storm, let's say, come through the body. Right. No, yeah.
Last question. I guess that was the last question. Well, thank you so much, Peter.
No, thank you. Appreciate it.
And of course, thank you all for coming as well. I just want to make a couple of announcements to end the evening. First of all, we do have other programs here, as I indicated at the start of this evening, for those who are here for the first time. Tomorrow night, we have a guided gong meditation with Marian and Gabriella Kraus. We have one of these each month by different people. Marian does one maybe 3 times a year. And that's it's a very pleasant and relaxing experience if you haven't experienced one yet. If you'd like to read more about it, there's a flyer outside and it's also in the catalog. And if you'd like to attend, please pre-register as it is cheaper rather than just paying at the door. Saturday afternoon, we have a workshop from 1 to 5 p.m., Introduction to Taoist Yoga, and we will have John Votow and Tasman Walker leading that class. Tasman Walker teaches life yoga class here on a regular basis on Wednesday night, and John Votow is her teacher, and he's the founder of Life Yoga System. He was an ordained Zen Buddhist teacher and trained as a Taoist master in China. So he has a lot to share. So the workshop is from 1 to 5 p.m., Introduction to Taoist Yoga. If you are interested in that, please go to our website and register for it. Thursday next week, our speaker will be Dr. William Wester. He is a senior scientist at the Fermilab National Accelerator Laboratory, and he has spoken here on a number of occasions. Next week, he will speak on the search for Planet 9 in our solar system. These lectures, especially when Dr. Wester does it or one of the other scientists, they are not specifically for scientists. They are directed for the general public. So don't think that it's going to be beyond your ability to comprehend. They are often very enlightening in terms of what is going on in the scientific world. Please come if you can, Thursday next week. And last and not least, please take one of these flyers, take a bunch of them, share them out with friends. We're really trying to promote this lecture, which will be on Wednesday, June 19th, at the College of DuPage by a visiting Buddhist monk who's quite an international celebrity or very highly regarded teacher. And we'd like to try and get as many people as possible for that. Thank you all for coming. Thank you, Peter. Please stay and have refreshments and, of course, continue the conversation further. Thank you all.